Welcome to Senior Strategies. I am your host, Amy Decker, Director of Client Services for Senior Helpers. We are so glad that you were able to join us today for lively conversations with guests that can offer you the tools, strategies, and support so that you can successfully stay on your journey as a caregiver. We hope that you enjoy yourself and find just what you needed to get you through today. Hi, welcome to Senior Strategies. I am so glad that you joined us today. I have a special guest, Kelly Absher, and she is with Hearing Space. And she's going to talk about the importance of hearing and how it can affect the whole rest of your body. It can affect your brain and what you need to do and not to do when it comes to making sure that your ears are working correctly so that your body works well. So we're so happy to have you, Kelly.
Thank you.
I'm just thrilled to have you here. I've listened to your presentations before and thought that they were just dynamic and interesting and informative, that I was excited that you could be part of my program. So tell us just a little bit about who you are and what you do and how you got to where you are.
Okay, I can do that. Thanks for having me, Amy. I appreciate it. So my name's Kelly, as you've already introduced that. Sorry, but I've been doing this for a little over 15 years. I started working with the Centers for Disease Control, traveling across the United States, doing hearing tests on people for research. So that's kind of where I got my passion and my love for this, is I realized there was a huge need out there in the United States for people to actually be able to have access to hearing tests, to have access to the correct information, because there was a lot of misinformation that I didn't realize either until I did this. We traveled to 42 states in just a few years, and we tested over 10,000 people in that time. So for me to be a part of something big like that just kind of changed my whole life trajectory and where I was going.
Yeah.
So I went back to school and, got my degrees and was like, okay, I'm going to do this thing. And I've worked for a few hearing aid companies that had clinics, and was able to learn from the ground up in those clinics, what's the way to run a good clinic, what are patients and what are the community's needs. And then I worked for a manufacturer for a few years of hearing aids, Sonova, and I learned so much about the inner workings of a hearing aid.
Wow.
Yeah, it was kind of cool to actually see the tiny little parts. And a lot of people don't realize that a hearing aid is really just a tiny little computer.
It's so tiny. Yes.
So tiny. Well, I would have never thought of it as a computer, but it really is. It has a microchip in there and everything, just like a computer. So that fascinated me.
You got the whole entire, from between the research and then actually working at the manufacturer company, you got the ins and outs of all of it, which is awesome. So you understand all of it.
I do. I actually started after the CDC. I worked at a front desk for a couple of years with a company. And so I learned when patients are coming in, kind of where their anxieties lie, what to expect. And it was surprising to me that many patients, when they're walking in the door to get their hearing evaluated, they're not sure what to expect. They're weary because, maybe they've had some past trauma in their ear. Maybe they've had a hearing loss their whole life. Maybe it's brand new and they think they don't have a hearing loss.
Right.
So it's really interesting getting to know people from that perspective at the front desk, and then finishing my degrees and then traveling into the back where I was the provider. So I feel like I've very well-rounded between the research, the front desk, the manufacturer.
Right.
And
you've come full circle.
Hearing space. Yeah, full circle.
Full circle. And I have to say, the majority, when we do an intake assessment to have to take care of our clients with senior helpers, I would say almost 90%, when I say, do you have hearing aids or does your loved one have hearing aids? There's two answers. Yes, and they don't wear them, or no, but they need them. Yes, and they don't wear them. No, but they don't need them. And then they complain if they do have them, they hurt. And then, or the background sound, or, they get clogged up and they don't clean them and maintain them. They get earwax in them. It's a bigger hassle for them, where I'm sure you've heard all of those things.
Yeah, and many, many more. For years, when I first started in the industry, there was such a stigma to people wearing hearing aids because they were a little larger. And the baby boomers in their generation, many of them grew up where, the look of the hearing aid was a problem. Like people had bad opinions towards it. So then people didn't want to wear them for those reasons. It's not sometimes that they didn't work, it's that maybe they didn't get the proper counseling from
Right.
their provider.
Mm-hmm.
And so I've learned over the years, just from listening to my seniors and my patients, that patients range anywhere from infants all the way up to seniors,
Right.
is that a lot of the hearing aid technology and wearing them is counseling. A lot of them just don't get they don't have someone listening to them.
Mm-hmm.
It goes such a long way when, if you're the person with the hearing loss, if your provider would take a few minutes and just listen to your concerns and your care,
Right.
then they're more likely to wear them more often and get the help that they need cognitively as well as with the being able to hear.
So do you
So
find a lot of them leave and then they just don't know how to wear them correctly, so they're not hearing correctly? Is that what it is?
sometimes, like, I've had many patients that have come in and they're like, I've had these hearing aids for 5 to 10 years and I just don't wear them, or their family member will come with them and say, my mom never puts these on.
Right.
And then I'm like, okay, can I see you put them on? And they're like, what? And I'm like, yeah, let me watch
Show
you put
me.
them on.
Yeah.
Show me what you're doing. And when I do that, a lot of times, believe it or not, the little tiny hearing aid that goes in their ears, the patients just don't get them in their ears all the way. They
Oh,
don't realize that they're actually missing what maybe to some people is common sense, but they can't feel their fingers. Maybe there's a dexterity problem. Maybe they can't, the numbness in their fingers, they don't realize that they're not actually getting the hearing aid itself into the ear canal.
right.
So it's kind of just sitting on the outside, and I'm like, oh,
Doing
no wonder.
nothing.
Yeah, no
Right.
wonder we can't hear.
Mm-hmm.
So it's that counseling when it gets to that point, you let them know, hey, you did a great job doing that. That's the first step. Now let's work on getting them where you can actually hear a little better. Sometimes it's a matter of they didn't know that their hearing aid was clogged and needed to be cleaned,
Right. Right.
and
Something as
so it's a
simple as
matter of,
that. And how
yeah.
often should they clean them?
So hearing aids in general need to be cleaned. It's really based on the user. I personally, when I wear them, or what I would tell any of my patients or family members is, once a day, take the hearing aid before you put it in your ears, and take like a toothbrush or a little alcohol swab, the little square ones like you've seen for
Right.
the diabetes, and
Mm-hmm.
just gently wipe off the tip that's going in your ear just for sanitary purposes.
Mm-hmm.
You may not need it. Some hearing aids, they actually don't need to be cleaned but just a couple times a year, because people don't produce a lot of wax.
Mm-hmm.
But if you're producing a lot of wax, it can clog up. There's a tiny little filter inside that hearing aid that goes in your ear canal.
Right.
If that filter gets clogged with even a pin, like a hairpin, of wax, it can stop the hearing aid from working.
Wow. So they got to clean their ears out too, on top of cleaning the hearing aid. They got to make
Sometimes,
sure they keep their ears cleaned out.
yeah, the best thing you can do for your ears is just whenever you're taking a shower, let some warm water run in there. That will help release a lot of the wax, because wax is sticky, but
Right.
we want the wax to be sticky. It's normal for everyone to have wax in their ears. People think, ooh, it's yucky, it's dirty. It's not. Wax is normal for everyone. We want you to have wax in your ears. Our ear canals are built with that wax for a purpose. It's meant to keep dust, debris, heaven, hopefully not, but bugs out of your
Right.
ears.
Right.
So we want that stickiness. It's okay. That's why when you take the shower, let a little warm water run down in there.
Mm-hmm. Mm-hmm.
Medically, if your physician is telling you don't let warm water run in because maybe you have an open eardrum, that's a different story.
Right.
But most of the population, it's easy enough for them to clean their ears that way. It's not a good idea to use Q-tips. That's not what
I know. And I don't
everybody
know if
wants
I
to.
could ever stop using Q-tips. Yeah. Because
Yeah, everybody
and you've
wants to.
said you shove it right back down in your ear is what you're doing, right? Isn't that why they're
You
bad? Yeah.
Exactly. So you're pushing that wax back in there, and our ear canals are kind of spiraled like outwards, right? So they're meant to push things out of our ears. So when you
Uh-huh.
put that
Tooth Q-tip.
Q-tip in,
Yeah,
pushes it in.
that makes
Yeah.
sense. That
So
makes
warm
sense.
water is great. If you have itchy ears, sometimes we have patients who come in and they have itchy ears, so they don't want to wear their hearing aid, maybe because their ears itch. The best thing is like mineral oil, believe it or not, olive oil, just a
Oh,
tiny little bit on your pinky and then just kind of
rub
on
it
the
in there.
outside
Oh,
can stop the itchiness.
uh-huh.
And it also will stop that wax from building up as much. And it's natural. And so you don't have to worry about it doing something wrong or have an
Right,
allergic reaction or anything because it's all natural.
right.
Yeah.
Now, what about tinnitus or tinnitus or how do you pronounce that? What's the word? Tinnitus?
It's like potato, right?
Okay.
Like tinnitus. It's pretty much it's the same thing, but
Mm-hmm.
different people pronounce it different ways. I'm sure if you go to one school of audiology, they're going to say tinnitus. You go to another one, they're going to say tinnitus.
Okay. What
It's
do
a
you do for
ringing,
that?
yeah, it's a ringing, roaring, or buzzing in your ears. Most of us have it, we just
Mm-hmm.
don't hear it. It's a natural way for our brain and our nervous system to let us know that something's not working, something's not right. The problem with it comes in is for some people, it's debilitating because it gets really loud.
Yeah.
It can be buzzing, it can be
Ticking
a ringing.
or like a ticking sound
It can be a
sometimes. Mhm.
ticking
A
sound. It
ticking.
can sound like cicadas. I've heard it
Mm-hmm.
described as that. I've actually heard people say they hear like a melody. Um, it was described to me many years ago by one of my professors is if you think of a sub, right? And when it's trying to do our hearing, when we're trying to hear things, because hearing for us, it helps us stay our balance. And the way it helps us with our balance, other than our little semicircular canals, is we're constantly sending signals out so we know how close the wall is next to us or where the floor is below us. So when we're missing part of our hearing, that tinnitus is kind of like that sonar, and it's like, ooh, I'm missing something. I'm missing
Right.
something. And so
Wow.
it's searching for it. Sorry. So when we think of tinnitus, there are lots of ways to treat it. The first thing that you need to do if you notice signs of tinnitus is the majority of the time, it's your first sign of hearing loss. It's your body and your brain's way of saying, something's not right.
Uh-huh.
So you'll want to go see your hearing health provider
Mm-hmm.
or an ENT and say, I have this tinnitus, I have the ringing, describe it. And then they'll do a test. Once they do a regular audio test, if you've never worn hearing aids before, sometimes, believe it or not, the hearing aids will mask and fix that tinnitus or tinnitus that you're
Oh.
having. It doesn't always happen magically overnight or the first time you wear them. Sometimes it could take up to 6 months. But that's the first step because a
Mm-hmm.
lot of times that's what it is. It's just your brain saying, wow, something's not right.
Right.
If it's not the hearing aids and you still have it, I have many patients who have it and still have it. It's a big problem and there's no proven cure for it. The
How
next
sad.
suggestion,
How
it's
sad for
very
those
sad.
that it's really, really loud and ringing. They probably have a hard time sleeping at night.
Some people do. I mean, it's I hate to say this, but I had a friend of mine, she had a practice in Alabama, and whenever it was so bad, the patient decided they couldn't live with it anymore.
Oh,
So it's a serious
oh
issue. It can get really bad
wow.
for people.
Oh my goodness.
So you have to follow the right steps to get the
Mm-hmm.
right help.
Mm-hmm.
Getting the testing done. There are all sorts of new treatments out there today that will help. There's one where you can put under the tongue and it kind of sends vibrations and sensations that help. One of the first things you should do is cut back on caffeine. I hate
Mm-hmm.
to say it, but caffeine is a huge issue if you have tinnitus because it's
Mm-hmm.
making those nerves even go a little bit crazier.
Mm-hmm.
Cut back on caffeine. Look at your diet. I know all providers and doctors say this, but it's true. It goes back to your diet, it goes back to what we're eating and everything to stay healthy. The next thing is make sure you're getting good sleep at night.
True. Mm-hmm.
And then there's sound therapy. For someone who has tinnitus or tinnitus, sound therapy is sometimes the only way they get through the day.
Wow.
So you have to really see a provider who specializes in this. Not all hearing aid clinics specialize in tinnitus and
Mm-hmm.
tinnitus. So you want to make sure you're finding someone who's been there. They've done the research. They've went to school and they've learned There's different techniques. There's a wristband now that you can wear. There's a sound therapy bed that is
Wow.
pretty amazing that I got to experience over in Paris, France from
Oh,
our
wow.
parent company. And there's lots of things, there's lots of ways to work with it. My
And is
biggest
it
piece of
your, I think you would, I think I, because I had talked to you about this before, is it the little hairs doing this, or is it something actually in your brain that's making that ringing
it's
sound?
both.
It's
It's
both.
both.
Okay.
Because those little cilia, those little hairs
Right.
that you're talking about, that's basically how when we hear sound, it's taking that acoustical sound that you hear and transforming it into it's transmitting it into a more of a mechanical or a that neurotransmitter sound, which your brain then reads.
Right.
So it's both. It's not just one or the other. When you're missing some of those cilia and those little hairs are gone and you can't
Right.
get them back, your brain is like, oh, I'm missing those. What's going on? It's trying to stimulate them. And
Wow.
part of the issue. Yeah.
What about people that so you had mentioned that you were just on a cruise. I took a cruise and I was horribly seasick the whole time I was on there. Does that have anything to do with inner ear? Is that really what that is?
It could. Yeah, I don't want to say 100% that it is because sometimes, but it definitely does. Those three little semicircular canals, if your little it if the crystals aren't aligned properly and from the moving back and forth, the
Right.
motion of that, and
Hmm.
it's so tiny, it's like smaller than the size of a dime. Like
Oh,
if you
I
were to
see.
see an actual physical size of one, it's smaller than a dime that affects us being upright and that motion sickness, vertigo, and
Yes.
dizziness.
Yes.
Yeah,
And right,
so
like you say,
tiny.
vertigo too. And then there's the poor people that have vertigo. Talk about something that would be very, very difficult to live with. That's one thing if you've got ringing in your ears, but vertigo is literally where the room is spinning.
Yes.
Now,
And
do
so
you treat for that as well?
we don't treat for that in the vertigo in our clinics. Generally speaking, if you have vertigo, you need to go to an ENT or an otolaryngologist.
I see.
That's a different scope of practice. We can help with it. There are maneuvers that you could help with. Some audiology practices do have them, but currently in ours right now, we don't do balance
Mm-hmm.
because that's a whole nother
Whole different thing.
it's a whole nother
Yeah,
scope
right.
of practice. Yeah.
What about cochlear implants?
Our scope of practice, we don't do cochlear implants either. It
Mhm.
is
That's a
something
whole
that you
nother
have
thing too. Yeah,
it is, you have to be specialized and trained in it. So, my suggestion for any patient that does have a cochlear implant, a lot of times they have a hearing aid and a cochlear implant,
uh-huh.
is you need to see someone that specializes in the cochlear because the programming is a lot different than a hearing aid. It's
I
getting
bet.
better. I took a course a couple months ago. It's getting easier. So, someone like me could do it, but it's very time consuming,
Oh, I
takes a
bet.
long time. And yeah, it's on our radar for the future for when they get a little better,
Yeah.
easier to manage.
What would you say to our listeners and to our viewers would be the top three things that you would suggest they do with their loved one who has hearing aids, or they're questioning whether or not they need hearing aids? Like, what would you say? Top three suggestions.
Number one would be to have a real heart to heart with your loved one if you're concerned about their hearing. And here's a question that people should ask their loved ones if their loved ones are resistant. Just say, what do you think is more noticeable, the hearing aid or your hearing loss?
Right.
Because a lot of people don't realize if you're saying, huh, and
Right.
what, can you say that again?
Right.
That's more noticeable than
Absolutely.
actually wearing a hearing aid.
That's a really good question. And for
Other
those
things,
too, like we were going to invite one of our neighbors over, and she said, "I'd love to come to your party, but I'm very hard of hearing, and if I come, I get so frustrated because I can't hear what other people are saying, and I'm constantly saying, I'm sorry, what did you say? I didn't hear you. I didn't." So it is. It's crippling.
It is. It can be isolation. That's another thing for family members to watch out for. If you
Mm-hmm.
have someone that you feel like they used to be really social and now they're isolating themselves more, hearing loss is also associated with and can be a sign of cognitive brain issues.
Yes.
It can be a sign of depression.
Mm-hmm.
So we need to look out for these things in our loved ones, and we need to ask the questions like, I noticed you used to be social. What's going on? Maybe it's something else, but maybe it is something as simple as like what your friend said.
Mm-hmm.
And it's just super frustrating for them.
Yeah.
There are ways now, hearing aids are so smart. Like
Yes.
when they go into these different environments with all of this noise and sound, we have phone apps now that we didn't used to have. Even 5 years ago, we didn't have them. Now we have them where they can go in and they can basically cut out all the background noise and just listen to the
Oh.
speech.
Oh, wow.
It's pretty amazing. They have Starkey came out with a hearing aid. You just double tap and it's like having a baby audiologist sitting on your shoulder, and it makes real time adjustments for what you need because the AI, it's learning.
Wow. And you're exactly right. It's like little mini computers in your
It
ears.
really is. It is. And we have these great tools now with hearing aids where we didn't have before, that the hearing aids learn the environments that the patients are in, right?
Right.
When the patient comes to see me, I can look and I say, "Oh, it looks like you were pretty noisy this week. What was
Oh,
going on in your life?" And then if they'll tell me, "Oh, well, I did this and I didn't like that," guess what? We can make better adjustments because I
wow.
can see, "Oh, well, you texted me and told me you couldn't hear in this situation, but I noticed you turned the volume down by accident instead of up." Like
Wow.
there's little counseling things now that we can use that we never had before.
No.
And it's making hearing aid use so much more friendly. And
Mm-hmm.
the patients are excited to put them on now.
I
Whereas I
bet.
even 10 years ago, everybody's like, I don't want to wear it. Now people are like, Kelly, I can't live without these things.
Well,
Like,
that's because you're personalizing them. Probably in the day, they were cookie cutter hearing aids. They popped them in their ear, and whether they worked or not, where now, if they're running a report, you can personalize just exactly what the needs are of your patient.
you
That's
can.
awesome.
It's
That,
so amazing. The
and I know
statistics and
they're
the data.
expensive. I know they're expensive. So how
Sorry.
the majority? How do they pay for it? Is it covered by insurances? How does that work?
That's actually a really great question. So, most insurances a few years ago didn't cover hearing aids at all.
Oh,
Insurance companies realized it's not fair. So, many of them now you have benefits. Many of the insurances these days will have at least 500, 1,000. Some of them even have full coverage, and
wow.
patients don't know it. So, we're constantly like alerting our patients, hey, don't forget, when I get a new formulary from an insurance, I send it out to my patients.
Good.
Hey, just so you know, your insurance now covers XYZ.
Wow.
And an important thing for patients to remember is every January, every insurance changes their formularies. So maybe last year they didn't cover a hearing aid, but this year they do.
Wow. Good
Maybe
to
last
know.
year they only covered battery, but this year they cover full rechargeable hearing aids.
Mm-hmm.
So it's very important to check. If you go to a hearing healthcare provider that doesn't accept insurance, go somewhere else.
Right.
I would say the majority of insurances today have some sort of coverage.
That's wonderful because they can range from what to what. A hearing aid can be as little as and or as much as.
Yeah, that's a good question too. Hearing aids in general, actual hearing aid and not an over-the-counter
Uh-huh.
hearing aid that is programmed by a provider will start at about $1,000 and go as high as $3,000 for one.
Okay. Oh, for
I've seen
one.
them as high as 7,500 for a set. I don't
Wow.
have any that high, but I've seen them that
Right.
high before.
Right. So if
Yeah.
somebody wanted to get with you and reach out to you, I know you have your offices and your territory is where?
So right now we have in the US, we have 7 locations. We have 300 locations worldwide, but in the US, we have 7 right now and hopefully expanding to 13 by the end of December.
Wow.
So as it stands right now, we're in South Florida. We're
Mhm.
in Palm Beach County and Broward County. Right now, we're in Hollandale, Plantation, Coral Springs, Boynton Beach, um, West Palm Beach. I'm in Lantana,
Mhm.
basically. Jupiter and DeLand.
Great.
That's where we're at now. You can find us online at hearingspace.com. You can call us. We're in all the Google fun stuff.
And what's the best number for them to call you?
561
Great. I think it's great. And I love it that you know the workings not only of the ear and what can happen with it, but actually what's going in the ear and how it's supposed to fit and how that little mechanism is supposed to be in there. And so you can answer so many questions. And like we said, a loss of hearing, I think I even heard at one point when somebody, and you had mentioned it too, it can cause brain issues where they're having the beginnings of dementia or Alzheimer's. And now they can't hear. It's just going to speed that process up so that whatever going on
Yeah.
in there now they can't hear anything. And I think you had mentioned once before, your brain always wants to hear something. It needs to
Yeah.
hear something, and if it's
Yeah.
not hearing it, it's going to make its own things up.
Yeah. There's a lot of misconceptions out there about hearing loss causing dementia, hearing loss causing frontal lobe. It doesn't. They go hand in hand.
Oh, good to know. Uh-huh.
There's a lot of brain things that are going on. The brain is a muscle, right?
Mm-hmm.
So if we're not using parts of our brain, we're going to lose it.
Mm-hmm.
And part of that brain is our hearing. So when we don't hear certain sounds, guess what? We lose it. And when you
Okay.
lose it, what happens? Other parts of your brain, when it starts to forget language and it starts to go down that pathway of, I don't need this, I don't need that.
All right.
That's where the correlation with dementia, Alzheimer's, and frontal lobe deterioration come in.
I
It's when
see.
those two bridges, they kind of meet and then they start to break apart. And that's where all of that comes in. It's why all of our providers really push for counseling, getting our patients to understand the importance and the need, because
Mm-hmm.
sometimes patients just don't want to wear it, but the loved
Right.
ones are like, you have to.
Right.
It's because we want to help you keep your brain as sharp as you can.
Right.
One thing that I would love to say here too, that I tell all my patients, our brain is a tool. So if you can do one thing, if you're not going to get hearing aid help because you don't want to wear them or you feel like you can't afford them, that's
Mm-hmm.
not always the case. You may think it, but times have changed. Read out loud to yourself every day. I know
Oh.
it sounds crazy, but just looking at a book or something and reading out loud for 20 minutes, when you see those letters and your brain registers the letters and you
Oh.
hear your own voice,
Right.
your brain says, "Oh, that's what a s sound is now. That's what
Interesting.
a ch sound is. That's how cat sounds." When you hear yourself say it, you can feel it in your
Right.
vocal cords.
Right.
You hear it. It's all those sensations that's making your brain kind of go, "Oh, I get
Oh,
it."
I've never heard
20,
that.
that's it. 20 minutes a day. Anyone and everyone, I would say you should do it your whole life. It helps keep your
Yeah.
brain sharp. It helps keep
Right.
your hearing sharp.
I,
It
I
goes a
do
long
catch
way.
myself talking to myself out loud during the day. I don't think it's the same
That
thing
works.
though.
No, you have to be able to see the
The
actual
word
physical
and read it.
words.
So it's not,
Yeah.
gotcha. That's great.
So your
That's a
brain
great
is putting them
tip.
together.
Any
Yeah.
other tips that you can give us that you think that our listeners should know that would be helpful to them?
Yeah, I would say once you reach the age of 40, it's
Mm-hmm.
important to get your hearing tested, even if it's within normal limits,
Mm-hmm.
every 2 years. If you have a hearing loss, you should have your hearing tested one time per year. And this is just to monitor, are there changes? Are there other things that are going on? Because
Mm-hmm.
also with our hearing is speech and language that we can
Right.
detect with some of these evaluations that we do in our clinics. So for me, it's super important to have those tests done if you have a hearing loss, at least once per year. And one of the most important things is if you have a sudden or rapid hearing loss, I'm talking you wake up and for some reason you can't hear on one side or something's wrong, you need to go to an ENT within 48 hours.
Oh,
And when you pick up that phone and you call the ENT, you make sure that front girl desk or front person
the
that's
receptionist.
answering the
Yeah.
phone understands that you had a sudden hearing loss.
What does that mean?
It could mean sometimes they can give you antibiotics that immediately will fix it. And if you don't get those antibiotics within 48 hours, you could lose your hearing permanently.
So what causes that suddenness for you to wake up so quickly?
Viruses. Viruses. It could be another medication that you're taking that had a side effect. And if you go to the ENT and they see that and they say, oh, you're on this medication, can we take you off of that for 72 hours and see if your hearing restores itself?
Wow.
It is so important. I've seen so many cases. It's so sad where someone woke up and they're like, well, I called the ENT. I told them that I woke up and I couldn't hear, but they can't see me for 3 weeks.
Oh my goodness.
If you tell that front desk person it was sudden, you woke up that morning, a good ENT practice will get you in either in the same day or the next morning, because it's super important. That sudden needs to be treated right away.
And within how many hours did you say?
48 hours.
48 hours. Wow.
Yeah. We're talking super quick.
Oh, yeah.
Yeah.
Well, that's helpful. You've always got something interesting, and I've always learned something new from you each time I hear you. So I'm happy that you could be on the show. I am proud of everything that you're doing, and I think you do so good for so many. And in a few months, we're going to check back with you and see how things are going. But thank you for all of your information. I do suggest for the viewers and the listeners, if you've got any questions, be sure to call in. You can also leave us notes on the Instagram, Facebook, but you were excellent, Kelly, and I appreciate all that you shared with us. And we're going to be chatting with you again in a few months.
Sounds good. Thank you. Thanks, Amy.
Okay. Thank you for watching our show. We hope that you found an answer to a question or a resource that can assist you. Our goal is to keep all of you that are caregivers informed, refreshed, and heard. We're here for you. Please don't hesitate to reach out to us with any questions. We have all the resources that you'll need. Please follow us on our Facebook and Instagram pages for the up-and-coming shows and events and support groups. Thank you for joining us, and thank you for your support.